Hey guys, Dr. Josh Axe here with Dr. Billy DeMoss. We're excited to be here with you today. We're going to be talking about posture. Now, I know that there are certain health phrases and things, Dr. Billy, that tend to be sexy. People like to hear about, hey, the newest superfood or the latest supplement or the most cutting edge natural treatment. But here's the deal. Posture is a big deal when it comes to your health. And most of you watching here today, you're slumped over, you're slouched over at a desk all day, or you're carrying around kids, or your posture is not good. And you may not realize that poor posture has actually been linked to things like pelvic organ prolapse and heart disease and high blood pressure and a number of other issues. So I brought in the expert, Dr. Billy DeMoss, who is a doctor of chiropractic. He practices in Southern California. And he's going to talk to us today about really how posture affects your body and some tips and exercises you can do to help naturally restore proper posture to the body. Dr. Billy, hey, thanks for being here with us today.
So posture isn't one of those sexy things? Is that?
Well, it might be. For some people, yeah, maybe it is sexy.
I think it is. I mean,
Okay.
obviously, if you look at people with poor posture, they're not going to be as
That's
vibrant,
true.
So
That's true.
I think it's more sexy than bone broth, but that's just my own opinion. All right,
Okay.
but I think how people look is super important. I mean, especially in society today, and we are in a society where it's epidemic, where people are sitting all day at a computer or looking at their phone all day, and you see it when we take care of people in the practice. And I mean, there's studies out now that even shows that the further forward a person's head goes and the further forward their posture goes, what it does is the study shows it increases pain and disability as people get older. But I mean, if you want to extrapolate that even further, I mean, it really ultimately will shorten a person's life. Yeah, I mean, it contributes to, like you said, heart disease. But what it does is it pushes a person out of a normal state into more of a sympathetic fight or flight. And there's just things that can happen when a person's in fight or flight. And obviously, one of the things is fight disease, and it's going to promote more of an environment where, people are going to be more susceptible to heart disease, cancer, and a myriad of other diseases. So the objective with normalizing posture is to get that tension off the spinal cord, get them out of sympathetic into parasympathetic, where the body gets a chance to rest, digest, increase immune function. But there's also studies that show the further forward a person's spine goes, the more stress, not only on the spinal cord, but it's going to put stress and tension on the vertebrae themselves and the disc, which causes those to prematurely wear out and create osteoarthritis and degenerative changes. And again, as your spine degenerates, so does your nervous system, and then so does your life.
So one of the things people may not realize is when we are looking at, let's say, an X-ray, just your posture from the front, we should see it should be straight up and down. If it gets to be too much of a curve, that's most often called scoliosis. And we know from the side you're supposed to have two curves: a lordosis, or a curve in your low back, this curve in your neck. And Dr. Billy, one of the things I'll tell you, and I guarantee this probably drives you just as crazy as it drives me, is when I used to have kids in my clinic on their Game Boy. I know I don't think they're called Game Boys anymore, but
I don't know what they're called either.
But phones too, and they're like this, literally for hours and hours on end. So that's pulling on that spinal cord. It's taking out that natural curve in the neck, and I could even see that contributing to learning disorders. We talk about things like ADHD.
Of course.
I mean, being a big thing.
Yeah, I mean, it's so funny you say that, because I flew home from a seminar I did in Atlanta, and there was a kid on the plane. Literally, he was like this for 5 hours.
Oh yeah.
And I'm just thinking to myself, there's going to be there already is an epidemic, but that epidemic is even going to get bigger.
Oh yeah.
And what people don't realize is that people do that 8 hours a day or at a computer, and the objective is we just got to teach people how to. If you're going to do this, you need to do some extension work. So that's why I recommend people maybe just hang their head off the edge of the bed, use a cervical pillow. We recommend people use dinner rolls, which is not dinner rolls, but dinner rolls are just appliances we use to help promote putting that curve back in. But the reality is just getting people cognizant of the fact that you're supposed to have that cervical curve in your neck.
Yep.
Again, I'm a surfer, so one of the things when I have to paddle, I can't paddle with my neck in flexion. I have to paddle with an extension. So I've been blessed by a sport that promotes my cervical
Yeah.
curve, and that's why I have a beautiful cervical curve. And and if you look at my X-ray, I have zero degeneration in my neck because of the fact that I've nurtured that curve through adjustments, exercises, surfing.
Yeah.
And to me, it allows me to function at a higher level. I mean, I'm 58 years old and I have tons of energy. I never get sick. And I attribute it to the fact, of course, I eat right, and I've got a Vitamix just like you do. I pretty much eat impeccably. I exercise every day. I don't watch any TV. I get great rest. The other thing is when you've got a good curve in your neck, you're going to be able to you're going to be able to get out of sympathetic, and you're going to be able to sleep better.
Yeah.
And like you said, things like, ADHD, I mean, kids' capacity to focus is going to be directly linked to the fact that you've got a good cervical curve. There's not stress on the nervous system pushing you into sympathetic. And it's just super important that people know these simple concepts.
Yeah, absolutely. So if you're watching right now, and again, if you're one of those people, you're sitting at a desk all day, or you're driving, even you're traveling on an airplane, or you've got a child at home, and you know what we're talking about. They're like this all day long. Really start incorporating some of these things Dr. Billy's talking about. Again, get these cervical neck rolls, these things that are going to support your neck. Really work on, even when you're walking, think about keeping those shoulder blades together,
Right.
sort of keeping those back on a regular basis. When you're laying around, rather than laying on the couch, slouched over like this, hey, get up for a bit, maybe lay on your stomach and do some of these exercises Dr. Billy's talking about. I noticed this in the gym too. I love going and working out. And, what guys love to do is they love to go in there and they're just like all pecs and all biceps.
Right.
It's like,
It's all flexion.
Hey, let's work on that, really work on that back, work on your hamstrings, your glutes, work on that, what they call the posterior chain when you're going to the gym, because those are other things too. You got to balance those things out. All of these things can help posture. And one of the biggest things that can help posture is getting chiropractic care. A lot of chiropractors do a great blend as well of chiropractic adjustments and recommending therapeutic exercises to help restore proper posture. We know there's groups like Clear Institute, great people like CBP and
Right.
Indeed Harrison,
Right.
and other Pettibon. There's other groups out there that do a good job of really teaching you how to do that. So again, go see your local chiropractor. Start performing some of these exercises. We know it's going to make a big difference in your life. And hey, check out Dr. Billy's website and his natural health movement. He puts on an incredible conference, one that I'm speaking at, called CalJam. So just Google that online, CalJam, Dr. Billy DeMoss. He's got some great information on there. He's got some great past speakers if you want to check it out, or check out his next up-and-coming event. Dr. Billy, hey, thanks for this great training on the importance of posture. It's
Thank you.
critical to health. Hey, thanks guys for watching.